At Maimonides, excellence never stops. Our physicians here in Brooklyn have the best heart attack survival rates in the entire U.S. and are among the top 10 performers nationwide for clinical outcomes across health conditions. We've created separate spaces and safe care pathways, so there's no reason to put your health on hold. Maimonides Medical Center. Extraordinary times, extraordinary care.
Breaking in Brooklyn now, Chopper 2 over the scene in Borough Park, where a young boy was struck by a car. Police say around 2 this afternoon. The 4-year-old ran into the street on 13th Avenue and was hit by a minivan. The child was rushed to Maimonides Hospital and remains in serious condition.
The hardest part was watching him get hit. That was, I mean, no mother should watch their child get hit by a car. It's very, very, very scary. And I just couldn't calm down. I was in shock. I was crying. I was like, he's not gonna be okay. Because when you actually watch the accident, nobody can tell you your kid's gonna be okay. Like, you saw it. Like, how is he gonna be okay? I just watched him fly and hit the ground and lay there unconscious in the middle of the street. So to me, it was like he's not gonna be okay. Finally, the neurosurgeon grabbed onto me. She was a woman, an amazing, we owe her so much. I mean, I think she saved his life. And she grabbed onto me and she said, "You need to calm down. He's going to be 100% okay."
That reassurance from the trauma surgeon, the head trauma surgeon, the trauma team as a whole, the nurses, the doctors, the level of care and the compassion and the way that everyone just gave themselves up to help our child is something that we'll forever be grateful for.
I just remember at one point they allowed us to take him out of the room, and there was this huge fish tank. I can't even tell you how beautiful. I just remember this moment of putting him into the wheelchair because he couldn't walk yet, and wheeling him out of the room and taking him to this fish tank. It was huge, like floor to ceiling, and his face, the way it lit up, to be able to see the fish and pointing at the fish. That was like the first time also that we saw his personality back and we're like, okay, this is gonna be okay. We owe them so much for giving us back our little boy, for giving us the best care possible, for making this crazy, it was a nightmare. And they gave us back our little boy, really. They really, really did. And we were in the best hands. We felt we were in the best hands. There was no other place we wanted to be.
Good afternoon, everyone. Thank you and welcome for joining us today. All of you who are here in person, not that many, and all of you virtually out in our new world. It is a great honor to be a part of such a great team that can put together projects like the one we're about to share with you today. It shows the true heart of our spirit, of our team and the commitment that we as Maimonides have to serve all of Brooklyn, the borough of Brooklyn. We are delighted today to be joined by a number of speakers who have played important roles to bring this project into reality. After we hear from our speakers, we will move over to the side for some pictures that officially will kick off the construction of this great project. With that, to start today's program, please join me to give a warm welcome to the chair of the Maimonides Medical Center Board of Trustees, Mr. Eugene Kalin. Mr. Kalin.
Thank you, Michael. There are 600,000 children in Brooklyn. On behalf of the Board of Trustees, I want to welcome you to the groundbreaking for what will become the first standalone emergency room for children in Brooklyn. This is a project we've been thinking about, hoping for, working on for a considerable period of time. And it's a great pleasure as well as a privilege for all of us to be here for the groundbreaking. It represents Maimonides' commitment to provide the very best clinical care to the residents of Brooklyn and to provide it in Brooklyn where they live. You know, this has been a difficult year. We spent most of it fighting a disease which can strike anyone, but which is most dangerous to the oldest among us. Somehow it's fitting that toward the end of that year, we are here with a project that will provide great care for the youngest among us. As I said, we are committed to providing that kind of care in Brooklyn to the residents of Brooklyn, and we are glad to do it.
Thank you, Mr. Kalin. I echo that sentiment. Okay, it is now time for me to introduce the President and Chief Executive Officer of Maimonides Medical Center, Mr. Ken Gibbs. Mr. Gibbs.
Let me add my welcome and say that we're pleased that you could join us as we kickstart an exciting period of growth here at Maimonides Medical Center. That growth is an essential part of executing on the vision that Gene described, providing the best care anywhere right here in Brooklyn. For the third straight year, the federal government's comparative survey statistics on survival show that Maimonides is among the top 10 performers in the country, and this year ranked #1 in the U.S. for heart attack survival. When we say the best care right here, we have the results to back it up. Today is about delivering that excellence in the area of pediatric care. As most of you know, Maimonides is home to Brooklyn's only comprehensive children's hospital, and we're home to the only pediatric trauma center in Brooklyn. And today, we are here to officially break ground on what will be Brooklyn's first standalone pediatric emergency room. Many have made this possible. This outstanding achievement was made possible by the over $140 million bond we announced and closed earlier this year in August, which was secured through a partnership with the U.S. Department of Housing and Urban Development. These funds will cover the pediatric emergency room and other exciting projects that we will be highlighting in the months to come. So let's talk about the pediatric emergency room and what it means for Brooklyn. It means a better patient and family experience, dedicated space for the professionals to deliver the best possible care, and increase our capacity to serve the thousands of Brooklyn residents who come through our doors. We will be able to turn the ground floor of this administration building into a standalone emergency room, showing the true ingenuity of the Maimonides team, the ability to reform and adapt to the needs of this community. When completed, expected in 2021, this will feature the widest range of outstanding services and enhancements, which you'll hear more about from our Chair of Emergency Medicine, John Marshall. It's no secret, as Jean has alluded to, that this has been a challenging year in so many ways, and for healthcare, and especially for our team at Maimonides that has given so much to this community. The fact that we are able to continue doing all of that incredible work while still making progress on crucially important projects like these is a testament to the skill of our teams here at Maimonides and the support of so many over a long period of time that have strengthened us. And so, not exclusively, but in particular, I'd like to recognize our board, our chair, Jean Kalin, the physical facilities chair, Jack Kittery, Jack's predecessor, Dan Nelson, and members of the Physical Facilities Committee, including Frank Nacarado, who is here today with us, and whose Community for Kids fundraiser, which was just completed at a record participation, helps fund these efforts, and of course, Monsignor David Casado. But in addition, I'd like to recognize Bar & Bar, the construction company, Cannon Architects. I mentioned the U.S. Department of Housing and Urban Development, our leadership team here that has been pivotal in conceiving the planning and implementing of this project, including Derek Owens, who I saw, Eric Scalatar, John Marshall, Mike Antoniadis, John Malia, Larry Torella, and others. Several Maimonides alums, including my predecessor, Pam Breyer, former CFO Bob Naldi, and former COO Dominic Stanzione, who's now the CEO at Brookdale Hospital. I also want to thank our partners, especially those who put their trust in us to care for them and their patients. Thank to all the community members who have joined us today, including the Fire Department of New York, Hatsola of Borough Park, Hatsola of Flatbush, and all of our city, state, and federal elected officials who have supported us and our children. With the support that we have been getting and that we are here to deliver, now more than ever is important as Brooklyn needs safe and effective access to top-flight health care. We see with the full diverse challenges that we are expanding to meet the needs of our community. There is a tremendous feeling of momentum behind what Maimonides continues to build, as this pediatric emergency room is the perfect symbol of how we can develop crucially important projects that will deliver better results for the youngest members of our community. As we look ahead to 2021, this standalone emergency room will help kick off an exciting period of growth and expansion for Maimonides. In fact, next month we will be celebrating the opening of the new 7-story Maimonides Doctors Pavilion on 9th Avenue between 48th and 49th Street, a world-class facility and a one-stop shop of exceptional care under one roof with 2 levels of underground parking, 240 spaces. More on that extraordinary event at a later date, and there will be more projects of growth that we will be rolling out during the course of this year. So, with that, I will turn the mic over to Mike.
Okay, our next speaker has been counting months, years, days, hours, minutes to this very moment. and is none other than the chair of emergency medicine right here at Maimonides Medical Center, Dr. John Marshall, who will give you everything you need to know about our exciting project and the soon-to-be pediatric emergency room. Dr. Marshall.
Thank you very much, Mike. And, on behalf of all of us who take care of children in the emergency department, and importantly, speaking on behalf of Brooklyn parents like myself and my wife and a lot of the folks who work down there, I just want to say thank you to all of you for being here. Thank you to Jean and Ken and Mike, our board of trustees and everyone who's made this important day happen. Brooklyn has more children than many cities have people. And despite the fact that there are more than 600,000 kids, 615,000, however many the number may be, children in Brooklyn are generally cared for in spaces that are really intended for adults. And, today is the first day of, really I should say the first day of an 8-year quest, because it has been a long time. It has been a long, long time coming. But today is a day that we're going to make that change. We're going to give children a dedicated space, a healing space, a child-focused space where kids can get the kind of care that they deserve from a world-class institution like Maimonides. And our kids are our most precious patients. They deserve that space. And so what will come into being on the space behind us, you can see some of the pictures here, is a freestanding healing space just dedicated to kids. Maimonides sees more children than any other pediatric emergency department does in the borough. We have the largest and best trained staff of pediatric emergency medicine specialists, really some of the best people, not just in the country or in the city, but in the world, who are here dedicated to taking care of children. And the space here is going to allow us to provide that care in an even better space. So whether we're talking about the waiting room that'll have child amenities and be focused on children, whether we're talking about a new pediatric ambulance bay where our EMS providers can bring in kids directly into a child-centered space, whether we're talking about new imaging facilities, state-of-the-art ultrasound, state-of-the-art examination rooms, places where families can be with their children when they're in the most need. That's what we're going to be able to deliver here. It's the kind of thing that's available in so many other parts of the country, and it's the kind of thing that Brooklyn has unfortunately lacked for a long time, but that's changing today. I'd really like to just close by thanking not just the folks I've already thanked, but also, I left out a couple of people when I gave thanks early. Importantly, our nursing staff, our technician staff, and all the other people who work downstairs in the emergency department to take care of kids every day. They are truly the backbone of the emergency department. They're the backbone of the hospital, and they're the people who are at the bedside creating the healing, caring environment that our children deserve. And I'd like to close by saying that here today, what we look forward to seeing here today is a real concrete embodiment of Maimonides' dedication to our children, to our communities, to the future of Brooklyn. Thank you very much. Thanks, Ken. Thanks, Mike. And have a great day, everybody.
Thank you, Dr. Marshall, and thank you to the fantastic emergency room teams and our fantastic Maimonides EMS teams, all the exceptional care and service that you provide to all of Brooklyn. With that, I would like now to ask Mr. Gibbs to please take over the floor.
And what I'm looking forward to doing is to introduce Eric Adams. It gives me great pleasure to introduce our borough president. He's been a tremendous advocate for Brooklyn's children, Brooklyn's health and healthcare institutions, and a longtime friend of Maimonides. He's secured direct support for equipment that will be used in the new pediatric emergency department. Let's all please welcome the borough president, Eric Adams.
Good to see you. Thank you so much. And this amazing hospital, I recall during the peak of COVID, watching the tents along this location here, watching the staff respond to all of the emergencies that came from COVID, never really losing their energy and their spirit, because part of medicine is not only what we do to the physical anatomy, but it's the anatomy of our spirit and real leadership. Ken did not send his troops into battle. Ken led his troops into battle from the front, and that is what a general will always do, and we cannot thank him enough for his real leadership. The hours that his team spent here to ensure that Brooklynites had a real feeling that we would get through this. And I want to say this in a very loud and clear manner. I remember September 11th, watching terrorism attack our center of trade and the buildings collapse. And the entire country looked towards New York. They wanted to know what would happen, and some people focused on September 11th. But let me tell you the day I focused on. I focused on September 12th. We got up. Hospitals opened. Retailers sold their goods. School children went back in school. And the entire country looked at the city and stated that we would not allow terror to stop us. COVID is a new form of terror. It's a foreign entity that it would have destroyed any other place. We became the epicenter of COVID-19, and the globe looked at us, and they say, how will we respond? And as we always do in the fashion of New York, borrowing from a Brooklynite, Snapple's owner, we responded in an appropriate way because we are made up of the best stuff on earth. We are Brooklynites, we are New Yorkers, we are Americans, and we will never be defeated by any entity of any form of terror. The opening of this pediatric emergency room and unit is a reflection of that. Because one thing has happened during COVID-19. Husband and wives were home and a lot of babies were made. And so we are excited that we're going to have a state-of-the-art way of treating our newborn leaders to this borough and this community. And so Maimonides, the team, the staff, your leadership, I thank you. These are the best ways to spend our tax dollars in an institution that would appreciate our tax dollars, be responsive to the needs of their community, and continue to provide first-class service in a first-class borough, in a first-class city. Thank you very much.
Thank you, Eric. And a lot of babies will be delivered right here at Maimonides Medical Center, as they have been delivered for many, many, many years. And it takes our physicians and it takes our nurses and everyone on our team. So with that, I would like to now welcome on the podium the Vice President of Nursing for the Emergency Department, as well as Behavioral Health Services, Josephine Imperatrice. Josephine.
So I have a hard act to follow. Thank you so much, for your words and support for our organization. Well, this is really a very exciting moment for us here at Maimonides Medical Center. And on behalf of the Pediatric Emergency Nursing team that's comprised of a dedicated team of registered nurses, patient care technicians, mental health workers, and clerical staff, we want to personally thank our senior leadership team and our colleagues of our physicians that have kept the vision moving forward to reach the moment that we are today. Having us freestanding, the first, hopefully to be the only, pediatric emergency room in the borough of Brooklyn. We will have this facility to represent clinical excellence for pediatric care in this borough and beyond. So with that, I look forward to breaking ground and to moving us forward as the premier center in Brooklyn for pediatric care. Thank you.
Thank you, Josephine, and thank you to all of our pediatric nurses for everything that they do every day, caring for the patients who trust us for their care. Now, our last speaker, I would like to introduce you and welcome to the podium the Chair of Pediatrics for Maimonides Medical Center, Dr. Jeffrey Avner.
Thank you, Mike. You know, you can tell a lot about a society by how they treat their most vulnerable. And you can tell a lot about a hospital by how they care for their pediatric patients. Because children can't advocate for themselves. They don't vote. They rely on other people to create an environment where they can grow up to be healthy and thrive. And in that sense, Maimonides is not just a mission-based hospital, but we are truly a hospital on a mission. And integral to that mission is to create a service that can provide high-quality, compassionate, family-centered care to children in Brooklyn and, in fact, the region in a space that's created specifically for them. The Children's Hospital is really the hub of a network of comprehensive pediatric care that includes physicians from 25 medical and surgical pediatric subspecialties. We have the largest pediatric intensive care unit in the borough and neonatal intensive care unit. And we are the only hospital in the borough that is part of the National Children's Oncology Group. But more importantly, we are acutely attuned to not just the medical needs of children, but also their psychological needs and the needs of their families. And when I look around every day at the doctors, the nurses, nurse practitioners, pharmacists, technicians, aides, child life workers, social workers, case managers, they all work with the goal of providing the best interdisciplinary care for children that is seen, frankly, at only the best of children's hospitals. So now, as we start construction on the cornerstone of pediatric care, the Pediatric Emergency Department, we should think, why does Maimonides and the community organizations and the families and the pediatricians work so hard to provide such high level of care to our children? And the answer is that we know that although children are only 23% of our population, they represent 100% of our future. So thank you all for being part of that.
Thank you, Dr. Avner. Okay, so now we are going to gather a group of us to go over to the grass area for the ceremonial groundbreaking action. And on behalf of everyone at Maimonides Medical Center, I hope that we get to see you all soon, on time. I'm looking at our partners at Bar & Bar. We're going to build this beautiful facility, and on budget, of course, for the grand opening, for the ribbon cutting. Sorry, I'm an operator. Thank you all. Keith. From there?
Be careful. I mean, let's make sure.
Fix the hat. I couldn't resist. I couldn't resist. Just fix the hat when you put it on, okay?
Huh? Oh, yeah.
Make it a little so it doesn't like sit like, you know, like a baseball helmet.
Kelly.